Welcome. You've taken a big step in treating your condition by seeing your doctor and getting a prescription for Cimzia. Now, before attempting to self-inject, please watch this instructional video in its entirety. For your protection, it's important that you carefully follow its instructions. Also, read the important safety information at the end of this video and refer to the accompanying medication guide. Remember, as with any medication, Cimzia must be taken as directed by your doctor. So we'd like to remind you not to miss any injections of Cimzia. If you forget to take your Cimzia, take it as soon as you remember. Then take your next dose at your regularly scheduled time. Make sure your doctor or nurse shows you how to inject Cimzia before you do it yourself. A friend or relative can also help after they have been trained in giving injections. You can also refer to the medication guide that comes in every package of Cimzia and that is also available at www.cimzia.com. If you're taking a trip, be sure to keep your Cimzia cool by using an insulated carrier with an added ice pack. And remember, always keep Cimzia, injection supplies, and all other medications out of the reach of children. If you have any questions at all about Cimzia or how to take your medication, make sure to call your doctor or call us at 1-866-4-CIMZIA.
Hi, I'm Erica, and I'm going to show you how to inject your medication. Believe me, it's simpler than you might think. In fact, you can do it in 4 easy steps. Take your syringe package containing Cimzia from the refrigerator. Remember, each pre-filled syringe contains one 200 milligram injection. Your doctor will tell you what your Cimzia dose is. First, make sure the name Cimzia appears on the dose tray and the syringe label, and that the packaging and seals aren't broken or missing. Check the expiration date on the syringe. Make sure the liquid inside the syringe is at the fill line. Also, check to make sure that the liquid in the syringe isn't cloudy or discolored. Okay, now let's get ready for the injection. Each Cimzia pre-filled syringe package comes with 2 glass pre-filled syringes of Cimzia, each with a fixed needle, 2 alcohol swabs, a medication guide, and full prescribing information. For each injection, you will use 1 pre-filled syringe of Cimzia with needle, 1 alcohol swab. You will also need 1 clean cotton ball or gauze pads, and a puncture-proof container for disposing of used needles and syringes. These are not included in the Cimzia pre-filled syringe package, so if you do not have all the supplies you need, talk to your pharmacist. Each pre-filled syringe contains 200 milligrams, the right dose of medicine for 1 injection. If you are prescribed to take 400 milligrams of Cimzia, you will need to use 2 Cimzia pre-filled syringes to take 2 injections. Cimzia may be injected into your abdomen or thigh area. If you are prescribed to take more than 1 injection, each injection should be given at a different injection site in your abdomen and thigh. Take either 1 or 2 Cimzia pre-filled syringes and alcohol swabs out of the refrigerator for injection, depending on your prescribed dose. If there is still a pre-filled syringe in the carton, put it back in the refrigerator right away. Let the medicine in the syringe come to room temperature before injection. This will take about 30 minutes. Okay, now we're going to inject Cimzia. Before you start, wash your hands thoroughly. Choose a different site on your abdomen or thigh for each injection. Each new injection should be given at least 1 inch from a site you used before. If you choose the abdomen, avoid the 2 inches around your navel. Do not inject into areas where the skin is tender, bruised, red, or hard, or where you have scars or stretch marks. Change injection sites between your abdomen and thighs to reduce the risk of reaction. You may find it helpful to keep notes on the locations of injection sites you use. Use an alcohol swab to wipe over the site where you will inject Cimzia. Do not touch the clean area again until you are ready for the injection. Now we're ready to inject. Remove the needle cover by pulling straight down on the rubber ring. Take care not to touch the needle and do not allow the needle to touch any surface. Place the needle cover to the side. Hold the syringe so the needle is pointing up and lightly tap the syringe to push any air bubbles to the top. Push the plunger slowly to remove any bubbles, just like this. Stop pushing the plunger once all of the air bubbles are gone. If a small drop of liquid comes out of the needle, that's okay. Hold the syringe with the needle facing down, like this. Do not touch the needle with your fingers or let it touch any surface. Gently pinch a fold of the cleaned area of skin. Insert the needle at about a 45-degree angle with a quick, short, dart-like motion, like this. Release the skin pinch. Keeping the syringe in position, pull back slowly on the plunger. If blood enters the syringe, this means you have entered a blood vessel. Do not inject Cimzia. Pull the needle out and throw away the pre-filled syringe and needle in a puncture-proof container. If no blood appears, inject under the skin all of the medicine in the pre-filled syringe. When the syringe is empty, remove the needle from the skin and press the clean cotton ball or gauze pad over the injection site for 10 seconds. Do not rub the injection site. You may have a slight amount of bleeding. This is normal. To avoid needle stick injury, do not try to recap the needle. Next, we'll talk about the right way to dispose of your syringe. Before you start injecting Cimzia, check with your doctor's office for instructions on how to properly dispose of syringes. Each state or town may have different requirements for disposing of used syringes. Ask your doctor or pharmacist how to get a puncture-proof sharps container that meets the requirements of your particular state or town. When the container is about 2/3 full, tape the lid closed and dispose of it as instructed by your doctor, nurse, or pharmacist. Do not throw it away in the trash or recycling. Alcohol swabs may be placed in the trash unless you are instructed otherwise. And that's it. Your 4-step instructions on how to use Cimzia. Now before you go, there are just a few more things you'll want to remember, so keep listening while I finish up here.
Important safety information you should know about Cimzia, certolizumab pegol. What is the most important information I should know about Cimzia? Cimzia is a medicine that affects your immune system. Cimzia can lower the ability of the immune system to fight infections. Serious infections have happened in patients taking Cimzia, including tuberculosis, TB, and infections caused by viruses, fungi, or bacteria that have spread throughout the body. Some patients have died from these infections. Your doctor should test you for TB before starting Cimzia. Your doctor should monitor you closely for signs and symptoms of TB during treatment with Cimzia. Certain types of cancer. There have been cases of unusual cancers in children and teenage patients using TNF blocking agents. Cimzia is not approved for use in pediatric patients. For people taking TNF blocker medicines, including Cimzia, the chances for getting lymphoma or other cancers may increase. People with RA, especially more serious RA, may have a higher chance for getting a kind of cancer called lymphoma. What is Cimzia? Cimzia is a medicine called a tumor necrosis factor, TNF, blocker. Cimzia is used in adult patients to lessen the signs and symptoms of moderately to severely active Crohn's disease, CD, in adults who have not been helped enough by usual treatments. Treat moderately to severely active rheumatoid arthritis, RA. Before starting Cimzia, tell your doctor about all of your medical conditions, including if you think you have an infection. You should not start taking Cimzia if you have any kind of infection, are being treated for an infection, have signs of an infection, such as a fever, cough, or flu-like symptoms, have any open cuts or sores on your body, get a lot of infections or have infections that keep coming back, have diabetes, have HIV, have TB or have been in close contact with someone with TB, were born in, lived in, or traveled to countries where there is more risk of getting TB. Ask your doctor if you're not sure. Live or lived in certain parts of the country, such as the Ohio and Mississippi River valleys, where there is an increased risk for getting certain kinds of fungal infections, histoplasmosis, coccidioidomycosis, blastomycosis. These infections may develop or become severe if you take Cimzia. If you do not know if you have lived in these types of areas, ask your doctor. Have or have had hepatitis B. Have or have had any type of cancer. Have congestive heart failure. Have seizures, any numbness or tingling, or a disease that affects your nervous system, such as multiple sclerosis. Are scheduled to receive a vaccine. Do not receive a live vaccine while taking Cimzia. Are pregnant, planning to become pregnant, or breastfeeding. Are allergic to any of the ingredients in Cimzia. Are taking any medicines, including prescription and non-prescription medicines, vitamins, and herbal supplements. Your doctor will tell you if it's okay to take your other medicines while taking Cimzia. Especially tell your doctor if you take Kineret, anakinra, Orencia, abatacept, Rituxan, rituximab, Tisabri, natalizumab. You have a higher chance for serious infections when taking Cimzia with these medicines. A TNF blocker, Remicade, infliximab, Humira, adalimumab, Enbrel, etanercept, or Simponi, golimumab. You should not take Cimzia while you take one of these medicines. How should I use Cimzia? Cimzia is available as a lyophilized powder for reconstitution or a pre-filled syringe. If your doctor prescribes the lyophilized pack, Cimzia should be injected by a healthcare provider. If your doctor prescribes the pre-filled syringe, see the booklet called Patient Instructions for Use, packaged in your Cimzia pre-filled syringe kit for complete instructions for use. Do not give yourself an injection of Cimzia unless you have been shown by your doctor or nurse, or they can train someone you know to help you with your injection. Cimzia is given by an injection under the skin. Your doctor will tell you how much Cimzia to inject and how often, based on your condition to be treated. Make sure to keep all of your injection and follow-up appointments with your doctor. After starting Cimzia, if you get an infection, any sign of an infection, including a fever, cough, flu-like symptoms, or have open cuts or sores on your body, call your doctor right away. Cimzia can make you more likely to get infections or make any infection that you may have worse. Patients 65 years of age or older, patients with other long-term medical conditions, or taking certain other drugs that affect the immune system, such as corticosteroids or methotrexate, may be at a greater risk of infection. What are the possible side effects of Cimzia? Cimzia can cause serious side effects, including heart failure, including new heart failure or worsening of heart failure you already have. Symptoms include shortness of breath or swelling of your ankles or feet. Nervous system problems, such as multiple sclerosis, seizures, or inflammation of the nerves of the eyes. Symptoms include dizziness, numbness or tingling, problems with your vision, and weakness in your arms or legs. Allergic reactions. Signs of an allergic reaction include a skin rash, swollen face, or trouble breathing. Hepatitis B virus reactivation in patients who carry the virus in their blood. In some cases, patients have died as a result of hepatitis B virus being reactivated. Your doctor should monitor you carefully before and during treatment with Cimzia to see if you carry the hepatitis B virus in your blood. Tell your doctor if you have any of the following symptoms: feel unwell, poor appetite, tiredness, fatigue, fever, skin rash, or joint pain. Blood problems. Your body may not make enough of the blood cells that help fight infections or help stop bleeding. Symptoms include a fever that doesn't go away, bruising or bleeding very easily, or looking very pale. Immune reactions, including a lupus-like syndrome. Symptoms include shortness of breath, joint pain, or a rash on the cheeks or arms that worsens with sun exposure. Call your doctor right away if you develop any of the above side effects or symptoms. The most common side effects of Cimzia are upper respiratory infections, flu, cold, rash, and urinary tract infections, bladder infections. Other side effects have happened in some people, including new psoriasis or worsening of psoriasis you already have, and injection site reactions. Tell your doctor about any side effect that bothers you or does not go away. These are not all of the side effects with Cimzia. Ask your doctor or pharmacist for more information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see the medication guide for Cimzia and discuss it with your doctor.